Hello and welcome to day 2 of the virtual summit, Level Up 2 Health Coach Summit. We'll give it a few more minutes for people to log on, and we'll get started for the day. Hi everyone, this is Dr. Chinelo Enwanu. Thank you for tuning in to Level Up to Health Coach Summit, Day 2. Just as a reminder for those who are tuning in for the first time, this summit is approved by NCHEC for 4 hours of CE credits, as well as by the National Board of Health and Wellness Coaches, and for those certified in public health. So you'll be able to get 4 hours of CE credits from participating in this summit. Make sure to go to our registration page to figure out the details about how to claim your CE credits. Just as a reminder and housekeeping, this summit was pre-recorded, and is being broadcasted live to you this evening. We have a couple of great speakers lined up, so please stay tuned. Because it's broadcasted, there is no live questions and answers for today's summit. And if you have any questions, go to the comment section on the registration page to post your questions, and we'll sure to get an answer to you. You can certainly send us an email or send me an email directly. All that information is on the registration page. So today's speakers, we have our sponsor, Healthie, that's sponsoring the summit today. You'll be hearing from Erica Jain, one of the founders of Healthie, and I won't get much into it because I don't want to spoil the surprise, but hope you'll stay tuned to be able to learn more about what's in store for you. And after Healthie, we will have a session with Ashleigh Fabian talking about nutrition for health coaches, and then we will proceed to finish up today's summit with All Things Mental Health by Nieisha Deed. And so let's get started for the evening. All right, well, thank you for being here with us today. We have Erica from Healthie to kick us off on the sessions on platforms for health coaching. Healthie is a platform that health coaches can utilize. We have Erica with us today. Thank you, Erica, and I'll turn it over to you.
Great. Hi, everyone. It's nice to meet you. Erica from Healthie here. I just wanted to spend a few minutes showing you the Healthie platform and how health coaches can use it to start and grow practices and build long-term relationships with their clients online. Effectively, what Healthie is an all-in-one HIPAA-compliant tool for you and your clients' website and mobile app. Makes it really, really easy to not only manage the back office needs for your practice, and I'll run through what that means, but also helps you build long-term relationships over telehealth, over secure messaging, over document sharing, food logging, and everything in between. What I have here is looking at Healthie from a provider end. You can actually run your entire business, manage all of your appointments, set up tasks for yourself. You can chat with your clients right through the system, so you're not giving out your personal cell phone or email address. You can build and distribute programs. You get to create and sell the content, whether it's a 12-week weight loss program, a mindful eating course, whatever you may want to share with your clients. You can actually add video modules and distribute those on whatever cadence you'd like for clients to receive. For those of you who are working with multiple clinicians and coaches, we have the full organization suite. So Healthie will help you scale your business and work with larger volumes of clients over time. Of course, the bread and butter and the heart of Healthie is the client engagement experience. So you can actually, if you're working with Jenna, view upcoming appointments and packages, process all of Jenna's payments through the system, keep track of credits and what she has remaining, the program she's enrolled in, set up a care plan as you work with her. One of the other really nice things is that Healthie allows you to have your clients take pictures of their meals and also log all of their metrics. We integrate with Apple Health, Google Fit, Fitbit, and other wearable devices to pull that data in automatically. And if you sell supplements, we integrate with FullScript for you to sell supplements right through Healthie. And then for Jenna, you can actually take all of your notes and do all of your note taking and have Jenna fill out all of her intake forms and assessments and waivers right through the platform. And we have a library of resources available to you as you're getting started. And of course, you can do telehealth right through the platform.
Oh, that's cool.
We also, related to this, have group video chat if you wanted to run webinars and courses with more than one person at a time.
So you can do group courses with individual courses as well? I mean, individual classes?
That's exactly correct, yeah. And then related, of course, we have both insurance and out-of-pocket billing, and we'll run into CPT codes and specifics in a few minutes, but what you're able to do is actually create client packages, and Healthie will connect with your bank account so that you can set up different payments and services. You can do recurring services. So for example, if you wanted to offer a 6-month platinum package of services, include a certain number of sessions, include a program, you would just set that up right within Healthie. Now, with regards to CPT codes for health coaching, it is definitely a growing area, and there are CPT codes that are emerging, sometimes with restrictions, but very optimistic that will get easier over time. With Healthie, of course, you can actually just create and submit the CMS 1500 claims directly within the platform. So you would just select your client, and Healthie will pre-populate a lot of the information that you need to bill for insurance. And we have a full list of ICD-10 codes and CPT codes that you would be able to use our database from, and then create the claim for easy submission.
Okay, so I'm glad you mentioned the CPT, because that was one of the things that we were going to cover today. So can you show me like where you would enter the CPT code specifically?
Yes, let me go ahead and show that to you. So if I go into, I'll do it on the Super Build, but you can easily do it on the CMS 1500 as well. You would choose the provider, the email, the phone number, enter your personal information, and then you would be able to go in and add in the CPT codes here. And we have a full database of all of the health coaching CPT codes. We have resources on our blog around the most common CPT codes for health coaches. So I'm happy to share that blog link with this group as well. Yes,
that would definitely be helpful, because it's a lot of questions that, I've gotten from some health educators, and I know with the CHEST folks, because there has to be advocacy on part of that population of credential holders, there's that need for them to be able to track the usage of the CPT codes. So as it moves from category 3 to category 1, hopefully that's the whole goal, they'll have some evidence and documents to show that, hey, we actually doing this services one-on-one with our patients or our clients, and we have, the numbers to support it.
Definitely. Yeah, I mean, relatedly, what you can do is you can pull reports on the platform related to client activity, client outcomes, appointment history, payment history, insurance information, as well as, CMS 1500s and super bills, which will allow you to run analyses on how successful you are with your insurance claims process.
Now, so for people that have FSA cards, does the Healthie platform support you taking credit cards, and if you want to bypass insurance and just do credit card or cash payment or, FSA billing?
Yes, that is a great question. You can absolutely take HSA, FSA on the platform, and it works very similarly as with credit card or debit cards. Yes.
Okay.
And for those of you who aren't taking insurance but are offering health coaching services, that's actually a great intermediate step, is to share that you're able to take payment via HSA, FSA.
Yeah, because some insurances will, or some employers will give their employees the benefit of health coaching, but it's through the FSA or the HSA, even if it's not directly covered under the insurance plan. So that's some avenues that I've seen some, health coaches go that route.
Definitely.
And then you can always do your reports by the type of insurance that you have or the type of payment. It's able to give you that report at the end?
Yes, that's correct.
Okay. Now, I use Healthie myself as a pharmacist and a health coach. I started looking into Healthie and building up my platform. I had started with chronic care management program and trying to roll it out with providers, but I struggled with finding a good platform that can do what I wanted at an affordable price. And then I stumbled upon Healthie, and I think I talked with Rebecca in the past last year, and then it's been great. It's been wonderful. So, can you talk a little bit about the subscription model for Healthie for those who are interested in getting started or utilizing it, what they can expect?
Definitely. So we have a few plans available. We've really structured our pricing to ensure that it was accessible to health coaches at any stage of their practice. And that's something where, we don't want price to be the reason that you're not using Healthie, because it can be so powerful for your business. And so our plans start at $29 a month and go up just based on the number of clients that you're working with and the features that you need. And we're here to help along the way, because again, we just want to make sure that you're successful in practice, that you can work with your clients, and just reduce the time that you're spending on this back office stuff, a lot of which can just be streamlined.
Yeah, I definitely agree. Definitely agree. Now, one question about the CPT codes. So even, and just to clarify for people that are viewing, even if you're taking an HSA or cash payment or credit card payment, you can still attach a CPT code to your service. So that way, when you're building your case, so you're trying to reach out to a provider and say, these are the clients that I've serviced in the past, and this is the level of service that I'm giving. When the insurance companies begin to reimburse for it and attach dollar values to it, now you have the data to back up and say, I've serviced, 50, 60 clients at this level of service with this amount of money. And this is the kind of revenue that I can generate for myself, for you, or for the practice.
Yes, definitely agree.
Now, can you talk about like the branding aspect of it? I know I started off with the basic, and I feel like, and for those who are viewing, the basic is still very comprehensive. You can get a lot done with a simple plan. So don't be afraid to try it, because I don't recommend stuff that I don't believe or trust in. So this, I really stand behind it. But talk to us a little bit about the branding that can happen if you go from the basic to the high level plan.
Yeah, that's a great question. I mean, I think philosophically, Healthie was designed to help your business and you succeed. So in any of our plans, our entire premise, every feature that we create is around how do we help you promote your brand and make it easy for your clients to pick up on. So we're looking for ways where we can make it really easy. So we can help you with changing the logo, the colors, but even on any of our plans, if you go into the settings here, you'll see that Healthie actually helps you create and send automatically a ton of emails to your clients around welcome emails, appointment confirmations, reminder emails, receipts, reactivation if someone hasn't logged in. And those all come from your name or your brand name automatically. So we're always looking for ways for you to promote your brand via Healthie. You can also link it to your social media accounts if you like. You can change some of the colors here. You can add your logo. But really, really Healthie was designed at any level to help you make it your account, not the Healthie brand for your clients.
And so you can integrate this with your website if you have an existing website, correct?
That's correct, yes. So you can actually pull links. So for example, you can share your calendar and then clients are able to book either from your website or if you want to post this on social or anything like any other platform or an email newsletter or anything like that.
Okay. And I saw when you were doing the demo earlier that you have like faxing options and telephone options. Can you talk a little bit about how those work?
That's a great question. So we actually do have an eFax platform. Yes, it's 2021, but one of the most secure ways for receiving and transmitting sensitive information is via HIPAA compliant eFax. And so if you're working closely with doctors' offices, as an example, they all use eFax. So what we can do is set you up with your own fax number, and you're able to send and receive faxes to communicate with other healthcare professionals right through Healthie. You do not need a physical fax machine.
Okay, and is there an extra charge to the faxing service? And is it per month or per volume of how much you fax?
Great question. So depending on your plan, it's included on our upper plans, or you can purchase it for an additional $10 a month on any plan that you have.
Okay. And then the labs feature, can you, is it a manual input of data of labs, or is it one of those that you sync to LabCore or, one of those?
Great question. So it's actually automatic. We integrate with Quest and we'll be adding additional labs this year.
That's great.
Yeah, so Healthie is one of the core EHR platforms that does this. Effectively, you can create a package and incorporate labs in your package. And then when you do so, what happens, so if I include one lab in here for vitamin D, it will then allow my client to schedule for vitamin D testing, and I will automatically receive the results as soon as they come in.
Now, have you seen from your experience, and you may or may not have the answer to this, those that are able to order the vitamin D test or certain type of labs, or do they always have to come from a physician?
So we actually have a third-party physician who can approve the lab. So even if you're working solo, we have a physician that can approve the labs for you.
Okay. That's good to know because I didn't know that piece of it.
Definitely.
And the one other thing I wanted to touch upon before we close off on the demo is the SOAP notes. And, for some people that are not familiar, the SOAP note is a great way to kind of interview a patient and get information about them. And we'll have a separate course on some of these strategies and things that health coaches can do. But just for the purposes of this demo, can you show us how the SOAP note would look like and how one can go about using it?
Great question. So Healthie has the SOAP note, ADIME note, or any charting template that you'd like really, and you can always go in and create your own. But effectively, SOAP can be a very powerful way to take notes. So this version of a SOAP note has some modifications to it, but effectively what it'll allow me to do is write down subjective, objective, and activity in a plan. as I'm working with my clients and take notes in a very easy to record manner during a session.
Okay, and while we're on the subject of, writing notes, can patients have access to give you information on Healthie? Can they download an app and upload their documents, or is it always me, the health coach, doing everything?
Great question. So Healthie can actually help you. You can actually share documents via Healthie to your clients, and your clients, when logging into their portal, they can actually go in and share documents with you directly as well. I just signed in as a provider. Again, give me one moment. I will sign back in as a client. And so I as a client can go in and share documents and resources with my provider directly through the platform. And so right now I'm logged in as a client. You'll see that it's a much more streamlined experience. I'm able to post an entry, view upcoming appointments, view tasks as I work with you. I can chat with you, view programs that you've set up for me, book an appointment with you, and pay for services. So it's a much more streamlined experience for clients.
Let's say I have a partner. I started a coaching practice with somebody else, and we share patients, or let's say I couldn't make an appointment one day, but she can cover and do the appointment for me. How does that work in terms of the other provider having access to the same patient that I have?
Yeah, great question. So you absolutely can add other health coaches to your business, and you can set up permissions such that if you want your other providers to be able to see your clients, you can set that up. Or if you don't want that to happen, you can prevent that from happening as well.
Okay. And is the Healthie available as an app, or is it just only web-based?
Great question. So it's available as a web platform and a mobile app. So you can use it on the go. Your clients can use it on the go. And it's designed to be very modern, intuitive. For clients, feel like a Facebook or Instagram account, because that's the only way that they're going to continue logging in.
Is through that platform. Now, I saw when you were going through the SOAP note, I saw something with the DPP, and I assume that's the diabetes prevention program. And that's another one that has a lot of, that's been gaining momentum, especially with diabetes prevention. Can you show us, does Healthie have an inbuilt module on diabetes prevention for those who are ready to just kind of kickstart? And can you walk us through it a little bit?
I'm a huge fan of diabetes prevention program. You're absolutely correct. You can run the program virtually through Healthie. You can add the modules, create, distribute them. What's really, really nice about using a program like Healthie for DPP is that engagement rates over that 12-month period, which is what was required to get reimbursement by CDC, typically fall off at the 3, 4, 5 month mark. But if you're engaging with your clients in between the actual sessions, whether those sessions be in person or virtual, and you can run the sessions virtually via Healthie or schedule for them from in person, is you're automatically collecting information from them, you're chatting with them, you're engaging with them. And we can also help you generate the DPP report that you need to submit to CDC at the end of the year. So I'm a huge, huge fan of using Healthie for DPP.
Thank you for walking us through that, because I do have, we had this course on prediabetes earlier, and then we ramped it up to the diabetes prevention program. And a few people have taken the course, but I found like some health educators struggle as to, when you actually look at what's involved in doing a DPP, you feel like almost get a little bit overwhelmed in terms of the reporting, how much you have to track. Like you said, keeping your patients engaged. But where I can definitely see how Healthie can make this a lot easier, because you move around with the platform, and then your patients communicate with you on the go. So I can definitely see how the engagement portion of it will not be a problem. And it's definitely, I think it looks like it's easier to scale from a program with Healthie versus trying to have like an install location where you set up a class and patients come. So for those that are listening and have always had questions about DPP, and this is a platform that I would suggest you definitely give a try. And so when you say generate the report, so you get everything together for them to submit to CDC?
That's correct.
Make it easier.
The spreadsheet that you need to submit to CDC.
Okay. Thank you very much, Erica, for the walkthrough on the platform on Healthie. I wanted to show some of the audience the stuff that we use as health providers and as health coaches, and definitely anything to make their practices easier and help them, build and grow. We're definitely here to do it. So I thank you guys for coming up with the platform too, because I didn't know about it until I stumbled upon it when I was doing research. It's like, oh, Healthie. It sounds really cool. And I checked it out and I loved it. And I'm definitely sticking with it and promoting it to whoever I can.
Thank you so much. It really means a lot. We definitely care truly about our providers and the clients that we work with and that we have the opportunity to work with, because we become health coaches and we go into healthcare because we want to help improve the lives of those that we work with. And so if technology can just make it easier, allow you to reach more patients, make more money, sustain yourself as a business, then we're just here to be a small part of that equation. So thank you so much for your kind words.
And before I let you go, I know as a subscriber, I get emails from you guys when you have free webinars about, a billing webinar or a telehealth webinar, something that comes up, and you guys share that. Can you give the audience a little bit more information as what to expect if they do decide to use Healthie as a platform, the extra resources that come to them?
Oh, definitely. Yeah, we want to make it, again, as easy as possible for you to get up and running, have the support you need, have the guidance you need. We offer webinars every single day around getting set up with the platform, deep dive topics on whether it's billing, insurance, calendar, telehealth, charting. You're more than welcome to attend. And we often also have specialized webinars. So we did a 3-part series last year on insurance billing. We're having, we have community members really lead those webinars. And so we typically have, one webinar every month just around certain industry topics that we highly, highly encourage you to join in on.
All right. Thank you very much again, Erica, for your time. And I will post resources for anyone who's interested.
Cool. Thank you.
All right, so we just heard from Erica with Healthie. Again, I do apologize, just a slight technical difficulty on my end, but definitely I was very excited to interview Erica, and the next speaker that we will talk to actually does utilize Healthie in her practice. So it was definitely an added bonus to be able to see a health professional that uses Healthie as well. And so next up, we will listen to the interviews from Ashleigh Fabian, who is a registered dietitian and nutritionist, and I hope you enjoy her session. Again, for those who tuned in late, there are CE credits available for this summit, and all the information about it is listed on the course registration website. Hi, I'm Dr. Chinelo Nwanwu, Director and Founder of Pharm PH. Check out our first virtual summit on health coaching happening this month. Hi, I'm Dr. Chinelo Nwanwu, Director and Founder of Pharm PH. Check out our first virtual summit on health coaching happening this month. Hi, I'm Dr. Chinelo Nwanwu, Director and Founder of Pharm PH. Check out our first virtual summit on health coaching happening this month. Hi, I'm Dr. Chinelo Nwanwu, Director and Founder of Pharm PH. Check out our first virtual summit on health coaching happening this month. Hi, I'm Dr. Chinelo Nwanwu, Director and Founder of Pharm PH. Check out our first virtual summit on health coaching happening this month. Hi, I'm Dr. Chinelo Nwanwu, Director and Founder of Pharm PH. Check out our first virtual summit on health coaching happening this month. Hi, I'm Dr. Chinelo Nwanwu, Director and Founder of Pharm PH. Check out our first virtual summit on health coaching happening this month. All right, for this session, we have Ashleigh Fabian with us. She's a registered dietitian. She's actually one of the content creators for the Healthy Eating course that we have on Pharm PH for those who are interested. So I will turn it over to Ashleigh to kind of introduce herself, and we'll get started with the session.
Yeah, hi, everyone. My name is Ashleigh. I am a registered dietitian in Tampa, Florida. I do a lot of contract work and freelance work, and I have a private practice. I focus mostly with clients who are wanting to improve their relationship with foods. So I'm all about food freedom and finding that, but also prioritizing nutrition. So I've worked in different settings, including grocery stores, with sports training, diabetes, heart disease, really anything and everything. And I've settled down here in Tampa.
Okay. One question I did have for you before, like, we really get into the content is, if you can differentiate or point out the difference between a registered dietitian and a nutritionist, and if you can make some of that distinctions for us.
Yes, nutrition, typically, there's not very much that you need to, I guess, credential yourself or classify yourself as a nutritionist. So there's often a lot of like 3-hour courses online, or like a quick, weekend seminar that you can take and then take a test, and then, you're able to call yourself a nutritionist. I'm not saying that there's not a place possibly for a nutritionist, but it's definitely not someone who could give medical nutrition therapy, or should be counseling for someone with, chronic diseases, or, may have issues with disordered eating or anything like that. Whereas a registered dietitian, you have to complete your bachelor's of science degree in dietetics and nutrition, complete a very intense clinical internship, and I forgot how many hours it is. I think 1,800 hours, but I'll have to double check on that. I've been out of school for quite a while now. And then you have to pass the national board exam as well, and then get licensed in the state that you're practicing.
Okay, because one of the reasons I wanted to have this session is because as health coaches, which are the audience that we have today, as health coaches, like, nutrition is something that, pretty much all the time people get questions about, be it like in terms of weight management, how to eat better and stuff like that. So can you talk about that value of nutrition education for a health coach? And also, if you can touch upon the distinction between, like, a what a registered dietitian can do and what a health coach can do, because obviously, to my knowledge, the approach is a little bit different, even though both specialties are talking about nutrition.
Absolutely. I definitely think that a health coach can definitely be beneficial. I think that health coaches can be really great resources to clients when it comes to general health, fitness, and wellness. And that can include a lot of different areas of life. But when it comes to nutrition, I think that the health coach can really help the client to identify certain nutrition goals, how to plan for those, and identify barriers that might be keeping them from reaching those certain nutrition goals. So just some barriers to success. And I think an example of that would be, say a client wants to eat more leafy greens, but they can't figure out how to get them in. And so they can work with the health coach and they can help to just identify some strategies that would work best for their lifestyle. So, they could suggest, well, add them into smoothies, stir frying them into eggs in the morning, or baking into muffins, something like that. So health coaches also often have a lot more touch points with clients depending on the setting. And so they can be more mindful on referring to the appropriate health professional like a dietitian when necessary. So say they're helping a client with one of the goals that I just mentioned, but then the client is really looking for a specialized diet like food allergies or something, or chronic disease, disordered eating, or something like that. So while a health coach won't provide medical nutrition therapy like the registered dietitian would, they can be a great support system, accountability partner, and they can really be a good guide to helping clients reach their health goals, which can definitely include nutrition.
Okay.
You turn the light on here. It's getting a little bit dark.
Yeah, it's fine.
Sorry about that. The sun went down so quick.
Yeah. Okay. Yeah, because I think it's good for health coaches to understand their scope of practice, to know that there are certain things that, while they should be touching upon nutrition and being that accountability partner for their client or their patient, they should also know their boundaries. Now, one thing you mentioned earlier was like you worked in like a grocery store as a dietitian. Can you touch upon your role in that setting? Because I think it's actually fascinating that grocery store departments are bringing on board nutritionists and health and wellness as services.
Absolutely. I had the opportunity to be one of the very first in-store dietitians for a major grocery chain here in the Southeast. And it was such a blessing because I got to provide a lot of different services to people who were coming in to shop, whether it was someone who was coming in and just, they have their grocery list and then they saw the dietitian office and they had questions. I got to help them. And we also got a lot of, doctor referrals from people in the area, but we did a lot of grocery store tours, shopping assistance. I formulated several programs for diabetes, shopping on a budget, heart healthy, grocery list, things like that. I think a health coach could also be very beneficial in this role for things like the grocery store tours. I think that that's something that they could absolutely be trained on, especially when it comes to like label reading and things like that. I also did, cooking demos. I would, pick some of my favorite foods each week and I would put it together and I would, show people, hey, you can eat yummy snacks and they can still be nutrient dense and they can be some of your favorite foods. And I think that that's something that the health coach would really excel in doing.
Okay. And even you mentioned you worked with athletes as well. And I know I've started seeing like health coaches work as personal trainers or go into the gym to kind of, bring health and wellness services to the patients, especially in this pandemic that we are in. It looked like even when people were doing gym, be it at home or some limited access to physical gyms, you hear people saying, oh, my trainer gave me, this food, suggestions of what to eat and things of that nature. Can you touch upon that as well from your role, and how the health coach can also fit into that aspect for people looking to, be fit or lose weight?
Absolutely. Yeah. So I think that, a lot of registered dietitians are also personal trainers, which I think is awesome. But I think that when a personal trainer might have that, how I talked about that nutritionist certification that might just be like or something like that. I know that a lot of personal trainers will get those certifications, and I do think that there is a place for that as far as providing that general health, wellness, like tip, making sure you're balancing your plate and getting enough water and things like that. I definitely think that there's a place for that in setting goals. But when it comes to specific, macronutrient recommendations, or, maybe, a lot of athletes struggle with disordered eating, especially, pro athletes or semi-pro athletes. And I think it's very beneficial for those people, or maybe the athletes that are training for a competition or sports, or, the Olympics or something like that. I think it's important to, not only work with a personal trainer, but also a registered dietitian when it's something like that. But I definitely think that the health coach has a role there, and can definitely be that accountability partner, and, help them to problem solve certain barriers that are coming up, and give that general health and wellness recommendations for sure.
Okay. That's some great information that you're sharing with us and with the audience. Now, there are some key principles that I think, and you can also share your opinion as well, that health coaches should know. Things like understanding food labels, which you mentioned, or healthy eating, which you helped us curate the course on, or meal planning. Like, can you touch upon some of those principles, and what the health coach should be looking out for or gaining more knowledge about?
Absolutely. So I think it's definitely valuable for the health coach to have, a knowledge base of certain nutrition principles, a foundation, because even though the health coaches aren't giving specific recommendations when it comes to nutrition, knowing the basics can really help the coach to better than help the client when they're trying to set some realistic goals. So some areas and goals health coaches could provide support in, that also include that understanding the food labels, like I was mentioning earlier, could also incorporate how to add more nutrient-dense foods into their diet, reading those food labels, and also meal planning. So I can kind of dive in a little bit more into each of those examples if you like.
Yes, please. Yeah.
So when it comes to reading the food labels, the health coach can recommend that, maybe they recommend the client starts with just reading the serving size. A lot of people are so fixated on calories when the first thing they're looking at is the serving size, because then the client just knows how that nutrition info that they're reading even relates to the amount that they're eating. Because without that, the information isn't really telling us much, because we don't know what portion size or what serving sizes that's relating to. So I think that's number one. And then also identifying key points like protein is huge, fiber and added sugar can be helpful as well. Keeping in mind that giving the specific amounts, you should eat this amount of calories per day, this amount of carbohydrates per day, that's information that I would recommend that the health coach wouldn't provide, because everyone does have different energy needs. They have different goals. They have a different medical history. So if a client is looking for specific information, this is where the health coach could refer to a dietitian. And in that case, one of the goals that the health coach could make with the client would be, speaking to the dietitian, setting up that appointment to meet with the dietitian. So I think, so when it comes to reading labels, I think that there's a lot of places to work with the client there. And I think, the health coach could also work with clients who are just trying to add in some more fruit, some more veggies, some more whole grains, just some more nutrient dense foods. So, you might have a client who is just struggling to get fruit in. Maybe they just don't like fruits. So, the health coach could explain some of the benefits of the fruits and that they contain antioxidants, and, encourage them to try them in different ways, maybe preparing them in different ways that they haven't had before, or pairing them with other foods. So, if you're not crazy about bananas, but you're willing to give it a shot, maybe pair it with some peanut butter, or maybe blend it into a smoothie. Frozen bananas in a smoothie are delicious. Makes it super thick and creamy. So I think it's just really important to meet the client where they are. So once you've met the client where they are, and if they're willing to try the new thing, that's really what the health coach is there for. You've gotten your client to really set and commit to the goal, and now you get to follow up with them at your next session or appointment.
And some of the things you mentioned, doing the smoothies and adding the peanut butter and the banana and things of that nature are things that I was suggested to do, because I've gone through my own health and wellness journey as well. And I've met with nutritionists, and, and it's one of those things that I'm glad that I did by seeking out that health and wellness center here in Virginia. It's made so much difference for me. But one thing I wanted to ask, and you could tell me if it's not within your scope, like, should nutritionists or health coaches be making recommendations for supplements? Because I know with everyone trying to be healthy and stay fit, and especially with COVID-19, you find people that just want to go off to the grocery store and buy vitamin D, buy multivitamin, buy this, buy that, without should it be advice that they should be giving, even though they've kind of figured out, vitamin B12 vitamins are good, or vitamin D is good, or vitamin C is good, but should be telling their clients what to go out there and buy?
I have a two-part answer to that. I would say the first part is no. The health coach should not be providing guidance on supplements, vitamins, minerals, unless they're talking about the vitamins and minerals that are in food. I don't believe that it is the role of the health coach or the nutritionist to provide that info. Just because, kind of like I said earlier, everyone is so different and everyone has different needs. So I would say no for that. And then the second part of my answer is that, diet culture is very good at convincing us that we need all these supplements, right? They're glorifying certain things and saying you need this to lose weight and you have to do this if you want to look like this, and selling us on things. And when it comes down to it, most people really don't need to supplement with much. I'm not saying that supplements don't have a place. There's a few supplements that I take, but that really comes down to your personal needs. So you would really need to work with a registered dietitian or your doctor to figure it out.
Yeah, because some people get, I was working with such and such person and they told me, and it's good that we're having this conversation, because one thing that we do stress upon in the fundamentals of health coaching class that we have is for health coaches to know their scope of practice, know what they can and cannot do based upon state laws, X, Y, and Z. I mean, someone who is a registered dietitian like yourself, who ends up becoming a health coach, can do so much more than just a regular health coach that has, credentials and training to be a health coach without necessarily that added layer of specialty to them. So it's kind of different, but still everyone should know the hats that they're wearing when they're working with their patient or their client. Now, for those who want to make referrals to a registered dietitian, how can they go about finding one, even for myself too? Where can you, is there like a resource or website?
Sure, yeah. So the eatright.org website, you can click on a link that's called Find an Expert, and you just type in your zip code, and all dietitians that are in your area will show up, because as an RD, you join what's called the Academy of Dietetics and Nutrition. And so typically every year they update your contact information, where you're at, and you can click to be, added to that list. So, yeah, that's the quickest and easiest way to find one. If you couldn't, you could call, like, even just like the local hospital, they would have some dietitians to refer you to, but I would start with eatright.org.
Okay. And that's a national website, I believe. Okay.
Yeah. Mm-hmm.
Now, in terms of meal planning, what do you think the health coach should know when it comes to meal planning? Because that's something that people do get, questions a lot about, like, well, how should I structure my meals? I'm trying to lose weight, or I'm trying to eat healthy.
Yeah.
But, give us some tips about what the health coach should do or can do with regards to meal planning.
Absolutely. I think for meal planning, I think first it comes back to meeting the client where they are first.
Okay.
Because meal planning is not right for everybody. I don't meal plan because I do not like eating the same thing every day. I just won't. I mean, besides breakfast, I'm pretty consistent. But besides that, I like to mix it up. But what I do to just kind of help make life easier is I do, choose my veggies or something, and I'll at least get them prepared. So if I know, I'm probably going to eat these veggies at some time during the week, I'll wash them, peel them, or chop them, and then store them. And then that way, at least that part is there. That part is easier. But if, say the health coach has a client who, they say, hey, I really struggle with eating lunch, during work because it's so busy and I just can't take a break. So they, that person, it sounds like they do need to do a little bit of planning, because, you don't want them to skip a meal. So one of your goals, could be, not to skip lunch. Okay, well, how do we get there? So I think that they could help them make a goal of planning ahead, preparing to, bring a meal that they enjoy, that they made ahead of time, maybe when they had a little bit more time. So maybe Sunday after church, or, Monday evening, if they get off a little bit early, that's when they do it. Even if it's not for the whole week, even if it's just a few days at a time. And then that way that they know, hey, I'm going to have a lunch tomorrow. I'm going to have energy tomorrow. I'm going to be able to fuel. So something like that, I think, definitely the health coach could assist on.
Now, I guess one thing that came to my mind when you were talking about eatright.org, how do people make referrals to a registered dietitian out of curiosity? And is it something that's typically covered by insurance, or do people pay for a registered dietitian visit out of pocket? Or is it covered by an HSA if they wanted to use that?
It could be. So
Okay.
as far as the referral go, that would depend on the setting in which the health coach is working at. So if it were, say, a business that hired on a team of health coaches, and they were, providing, they were a part of like the employee wellness, they would probably be able to refer to a dietitian that they probably had in network, and it probably would be an insurance company. Not all the time, probably. But that really depends on the setting. If someone needed a dietitian and, it wasn't through the workplace, it was just maybe a friend or something like that, that's when you would go to the eatright.org, find the expert, and you would just contact the dietitian directly. You could also go through your doctor. Most doctors should have, some contact information, but I would say, you could definitely check out which dietitians accept insurance. Not all do. Some are credentialed. So I lived in Pennsylvania for a bit when I first graduated. And yeah, and I was credentialed with a bunch of insurance companies, and I did accept clients through insurance. Now that I'm back in Florida, I haven't done that credentialing process, so my clients do pay out of pocket. But it kind of just depends on the dietitian, on the practice. But they're usually through the hospital if they have an outpatient dietitian program. So that meaning you don't have to be, a patient of the hospital. A lot of those cover insurance, even if it's 50%. And I think on the eatright.org website, I believe it lists next to each provider if they accept insurance or not. But you could always just contact them and see.
Okay. I've always been curious about how that referral process actually works. Because most of the health and wellness centers that I go to are, out of pocket prices. And then some of them are like a membership fee, like you do a monthly membership to go and you get access to a nutritionist and the acupuncture service and whatever else they want to offer you. And so I just thought about that. I wanted to ask. Now, you had mentioned that you do freelance work. What does that kind of look like for you? And do you do across the nation, or if people wanted to work with you or connect with you, how can you do that?
Yeah, so it looked a little bit. Just with COVID and things like that, I've switched up different things that I'm doing. So my freelance work, I partner with different businesses, whether they're here in Tampa or they're across the country, really everywhere. Maybe I provide educational classes, or I create presentations, or I might do one-to-one counseling or coaching for people, through those organizations for their employees. But I do have my own practice where people can sign up for a waiting list, and then I start counseling them one-to-one. Right now it's all virtual. So I use a dietitian platform. It's called Healthie, Healthie. And it's all HIPAA compliant. So I counsel clients through there. Right now, I'm not accepting any new clients. I'm just seeing the clients that I have right now. That I have a waiting list, and it's been great. I can work from anywhere, and I can still, do other in-person kind of jobs if I want to, at different wellness fairs, opportunities, things like that.
I'm glad you mentioned Healthie. I actually didn't realize that you use Healthie, because Healthie happens to be one of the sponsors for the summit. And we had a session on Healthie as well, talking to the audience about it. So this is like an added bonus for me, as well as for the audience, to actually see a professional that's using Healthie and has, I'm sure your experience has been great, since you're using it virtually to see your patients and connect with them across the country. So it is definitely good to know somebody else who's using it live and can say, hey, this works. And it's like you said, it's HIPAA compliant, and that's a tool that I've advocated for our audience to utilize, or if they want to get started with the health coaching practice, because it has all the functionalities that that anyone needs to set up a practice pretty much. Yeah. So will they be able to find, well, you said you're not accepting new patients, but if anyone searches for you, can they find you through the Healthie platform, or is there like a particular website that you have?
There, I am providing a lot of free nutrition tips and content right now through social media. So that's where I meet most. I would say 90% of my clients find me through Instagram. I do a lot of just content and tips on there, and my Instagram is at Ashleigh's, ASHLEIGHS, Rooted, ROOTED, Life, LIFE, Ashleigh's Rooted Life.
Okay, and then, that's good to know, because another thing that some of our speakers are able to do is to promote some of the free resources they have for our audience. So let's say somebody is looking for information on nutrition tips, they can reach out to you or follow you on Instagram.
Yeah.
What's your website URL if you have one?
Because I took down it's just a wait list. I have the website disabled right now just because I was in an influx of inquiries and I can't take on any more people right now. So right now I'm just doing the clients that I have and just the content on Instagram for right now.
Okay. No, that's good. That's good. Because the others.
I'm sorry, when I have it back up, it'll be the same thing as my Instagram, ashleighsrootedlife.com. Probably in another month or so, I'll be able to take clients again, so it'll be back up.
Okay. No, well, that's great news and perfect to know, because the other speaker that we talked to earlier on mental health, and she has this peer support group that happens virtually across the nation. So I thought that was a good resource for people who wanted to refer their clients to a peer support group that's completely anonymous, and so now having you share this one is an extra bonus for us. So I thank you very much. Now, before I let you go, any other words of advice or suggestions that you want to share with the audience?
Yeah, tips, I would say first things first, I think it's most important to build a rapport with your client. You chose this career because you're passionate about helping people and you're passionate about helping them to live their happiest, healthiest life. And the way that you can do that is by building trust with them. That's always going to be the very first step. So I'd say that's number one. And then number two, I've said this so many times, but I mean it, is to really meet your clients where they're at. You don't want to overwhelm them. You don't want to feel like that. You don't ever want to make them feel like, you're judging them, even though you're not. Sometimes our clients, if we provide too much information, they might start to think, oh my gosh, I'm not doing enough, and it can cause extra stress. So just listening to them, meeting them where they're at, and assessing their readiness for change. Small and realistic changes are always going to be the best place to start, that are going to fit into your client's lifestyle. And the third thing, I've already touched on this as well, but just being really proactive in referring to the appropriate health professional when needed. It's okay to tell your client, hey, this is a little bit out of my scope of practice, but I would love to refer you to the dietitian, or whether it's the psychologist or a doctor. It could be anybody. Just like if someone came to me and they needed help that maybe I couldn't provide to them, maybe it wasn't necessarily in my scope or nutrition related, I would say, hey, this is out of my scope, I'm going to refer you here. So it's okay to say that. It's okay to say, you don't know, but you will help them get the right answers.
All right. Well, thanks again, Ashleigh, for your help and for doing the interview with us. And we look forward to connecting with you when your website comes back up again. All right. Thank you, Ashleigh.
Okay. Bye.
Hi, I'm Dr. Chinello in Monroe. Hi, I'm Dr. Chinelo Nwanwu. All right, for this session, I have a good friend of mine, Miss Nieisha from Pure Spark. And so she's a mental health advocate and founder of Pure Spark. So I'll let her introduce herself and we'll get started with this session.
Hi. Uh-oh. Does that sound okay? Hopefully it sounds okay. Good morning, good evening, good afternoon, everyone. Like Dr. Chanel just mentioned, my name is Nieisha, and I am the founder of an organization called Pure Spark. Founded about a couple of years ago, but we really started digging in and doing a lot of hard work between 2020 and 2021 as it relates to educating people on mental health and sharing my story. So thanks for having me.
Okay, so tell us a little bit about Pure Spark and what motivated you to start your business.
Yeah, so I'll try to make this brief. I first learned about mental illness at a very young age. Actually, I was 10 years old when I first learned about mental illness, and that was because of an uncle of mine who had schizophrenia, and he later ended his life due to the anguish that he had with his mental illness. Very smart man, engineer, and all this great stuff, but the illness really made a toll on him. So I think what happened to me as a child, I thought, okay, this is a very unique one-off type of situation. It's not that prevalent, like whatever. And speed up 20 some odd years. And now at this age, I've lost a total of 5 family members and had my own instance of mental illness. And I realized that mental health and mental illness is something that is super important and that we need to start paying more attention to. So in order to do that, I shared my story. I shared my story with a hospital up here in Massachusetts called McLean Hospital. It's a mental health hospital here in Belmont, Mass. And then I just started sharing more information to kind of educate people. And in 2020, we actually started doing peer support groups to bring together professionals with the clients who need their help. And more recently, we developed a wellness directory for people of color here in Massachusetts.
Okay, and so your peer support group, is that virtual, is that in person, or just Massachusetts based, or can anyone be a part of it?
Anyone can come. It's open to the public and it is free. And people can register on Eventbrite. You can just Google Peer Support by Pure Spark and it'll probably be the first thing that pops up. Or you can go to our website, www.yourpurespark.com, and go to the events tab and you'll find it there. And it is currently virtual because we are in the pandemic, so we want to keep everyone safe. But hopefully once things get better and we're out of this pandemic situation, I'm hoping that we can do it in person. But for now, just for the safety of everyone, we are doing it virtual over Zoom.
Okay, and so for majority of the audience that we have today are health coaches or health education specialists, or people looking to get into the health coaching field. And one of the reasons why I invited you to speak to everyone is because, again, like you already know, mental health is such a crucial aspect of someone's health and well-being. And also, as health coaches or health professionals, it is good to know that there are resources that are available out there. So when you're helping your clients or your patients, you know where to turn for help. So it's good that you're telling us about your peer support groups so people can refer their clients to join the group if they want to. And we'll talk about your wellness membership for professionals in just a few minutes. But again, I just wanted to stress that importance because health coaches or health education specialists don't necessarily have to be a jack of all trades. They should know that, hey, my patient is going through some mental health stuff. I need to make referrals, and there's this resource. Now, tell us a little bit about the membership aspect for wellness professionals and what that looks like and what's involved in it.
Yeah, so currently our website in the wellness directory that you're referring to, the www.yourpurespark.com, it's really for wellness practitioners currently in Massachusetts, but we're hoping to expand once we get things kind of settled and kind of understand the market a little bit better here in Massachusetts. But just for a broader understanding of what the wellness directory is and who we look to have on the wellness directory, it's open to a plethora of different people, right? Because with my own experience, I learned that my journey to mental wellness wasn't just about going to see a therapist, and therapy is a part of that, was a part of that for me, and can be a part of that for other people. But we kind of think about it in three different ways: mind, body, and spirit, or mind, body, and soul, rather. And when we talk about the mind, we are really talking about people that are life coaches, nutritional coaches, therapists, and those types of people that think about help people with their thoughts, which in turn help them with their behaviors. So let's say if you are a therapist, obviously that's one that most people are familiar with, and you are talking to someone who has depression. Sometimes their depression can affect the way that they eat, can affect the way that, their health is, right? So, we have to start thinking about the mind, body, and soul connection, because we're all connected. And then when we think about body, we're talking about, again, nutritionalists, yoga teachers, dance therapists, those people that fall under those category. And soul is, usually the area where people are kind of like, what is soul? What is that? You can't feel it, you can't touch it. But we're talking about people who deal with, maybe certain types of energy. So there's, Reiki specialists coming in from Japan, or that's the practice that comes over here from Japan that focuses on chi, which is the energy in the body. And this is a practice that's actually used in the hospitals. My sister works at a hospital here in Boston where they actually use it to help decrease the amount of pain meds that they give to certain certain patients. Yeah.
Okay. And that's a membership-based business for the wellness professionals?
Yes, correct. Okay. So it is a membership based. So think about it just similar to Psychology Today. If you never heard of Psychology Today is similar, but it's just for therapists. And you pay a subscription in order to be able to have your profile listed. And it's really Psychology Today who is helping to drive clients to you. So we think about it in the same manner. We think about ourselves as a connector. We're connecting resources with the people that need them, plain and simple. And so if you're someone in the wellness industry that's looking to obtain more clients, you would be paying a membership in order to do so. And our membership is fairly low. It's about $240 for an annual membership, and it is about $30 for a monthly membership. But you really kind of got to be on there for some time to see the inflow of new clients coming in. But we've noticed from our peer support by Pure Spark that we are really able to make a lot of connections. So why not make it on a broader scale?
What was the reception like in Massachusetts when you came out with this advocacy for mental health and your platform and, the membership and all that stuff? What was the response like?
Yeah, when I first came out with my story, I think people were shocked because people that know me and know about where I came from and my background, they just would have never thought that I was someone who struggled with mental illness. So when I came out with my story, it was kind of like, whoa, like you're a human being. And I'm like, yeah, I am actually, I'm not a normal person, I struggle too. And I still try to make sure that I prioritize my own mental health. It's tough, sometimes when you're doing day-to-day work and, and then you're like, wait a minute, did I rest? Did I eat? Did I do these things? But when I first opened up and shared my story, people were kind of like shocked. And then people actually started DMing me and, reaching out to me and saying, wow, I too struggle with like depression or anxiety, or I have a bipolar disorder. and I have this, and our family member of mine. And then I started to realize, okay, wow, this is something that affects so many people. We just don't talk about it. And then because we're not talking about it, people don't get the help, or they're afraid to bring it up when they're sitting across from a professional that wants to help them.
Yeah. And I'm glad you mentioned about you taking care of your mental health, because sometimes as health professionals or health coaches or, anyone in general, you get so engrossed in what you're doing on a day-to-day basis, more especially if you're like in the health professionals or taking care of people. You're like on the go all the time. What am I doing for my patient? How many clients I'm seeing? Oh my God, are my patients doing well? That you forget about yourself. So it's always a two-way street. It's about the patient. It's also about yourself and maintaining your own mental health, as well as knowing the resources to help your client, because your patient might have diabetes or might be going through stroke. And those things kind of, make them depressed or make them feel a little bit anxious. And they might not necessarily know how to talk to you about it, because they're like, oh, she's a professional. She has it together. She has everything going for them. They probably don't know where I'm coming from, that it's hard. So I'm really thankful that there are people like you and your organization that are out there advocating for mental health. Now, I did follow your story a little bit and some of the things that you're doing on Pure Spark. And can you talk to us about the session you had on corporate health and wellness and being able to survive being in corporate America? So I thought that was such a beautiful piece.
Yeah, so that actually was something that a friend of mine hosted on Clubhouse, which is an app that currently just is only available for iPhone users. So all you Android folks, if you don't have it, hopefully they will allow you guys to join in soon. But Clubhouse is just a very cool app where you get to host these different conversations in these different rooms and invite people to join in on those conversations. So a friend of mine and I hosted, Surviving Corporate America. And the funny thing was, I was like, well, guys, I didn't survive. I actually left. But here's what I learned, it was really me talking about corporate culture and how corporate culture can be somewhat toxic, especially when everyone around you is accepting it, right? That's why we call it a culture, because it's an accepted behavior. And so I was working in an environment where working 12, 13, 14-hour days was kind of expected to a certain degree. And so because it was expected, you thought poorly of yourself, or I thought poorly of myself if I wasn't able to reach that standard. And I think that that's extremely unhealthy for a person to do. But obviously it's good for the corporations because it helps them to reach their bottom line and exceed their bottom line in a lot of cases, which is great for investors and all these different things. So I think in order for companies to really, really do the work and become a company that's about wellness and about the people, sometimes that might mean that they're not going to be able to make those, hit those numbers, and I don't know how many companies are ready to do that just yet, because we are living in a capitalistic society where, making more money is kind of always the thing to do. But I, for myself, had to get out of that situation because it was not healthy for me. And after being in that situation and being in that experience and living in that culture for 15 years, it took a toll on me, both mentally, physically, emotionally, spiritually, everything. And I feel so much better now that I'm not there.
And I'm glad we're also having this discussion, because I was reading an article a couple of weeks ago about the culture that we live in and how mental health and health and well-being and wellness is going to have to step up in the culture of companies and in benefits. And we've noticed it with the pandemic and people working virtually. Some people have felt, more stress. For some people, it's good. Everyone's different. So for some people, the environment works just fine. And for others, it's different. And so we can't say everyone has to wear the same shoes or be in the same bucket, because we have to do things differently. But as we look at how things are going to change in the future, companies that are embracing health and wellness are the ones that are, going to be able to stay on top or stay above the others, especially making things available to them. And it's like when you turn onto the internet, you're seeing things about mindfulness, relaxation, stress management. So I think we can't ignore mental health for too long without having to address it. And that's why, as health coaches or people getting into the field, it's good to know what's out there and what we can do to help ourselves and help our clients. Now, I kept meaning to ask you, is your business like a nonprofit? Do you have partners? Like, how do you get started? Because also there are people in the audience that may have had some great ideas, especially you getting started in the pandemic and really hitting the ground. Like, what suggestions do you have, or what have you learned from the process, being able to take what you knew before and say, hey, this pandemic is a great platform for me to start talking about mental health?
Yeah, so actually Pure Spark started before the pandemic. So it was kind of like, I think the pandemic was able to allow us to do more work and more work with more people. But if you are a person that has an idea and you're looking to start something, I would say just do it. I think for me, in my experience, I was lucky, right? Because, I have a lot of support. So I don't do everything alone. So if you can find people to help you and to support you, I'm also I currently enrolled in a business accelerator program called E4All Roxbury here in Boston, Massachusetts.
Okay.
And that has also helped me. So if you can find this organization, E4All is a nonprofit, Pure Spark is an LLC. We did not go the route of nonprofit because it's so many there's so much work involved with being a nonprofit. It just didn't make sense for me currently at the time to go that route. Maybe who knows what's going to happen in the future. You can always change your the type of business that you want to be. You can always, change it around. There's plenty of businesses that have done that. They've been nonprofits and they turned LLCs and they turned something else. But for me right now, currently, LLC is what we're going to stick with. And yeah, I think it's mental. I will say that. Being an entrepreneur is mental because you will have struggles, right? And you'll have this great idea and you're hoping that it will land well. And sometimes it does, sometimes it doesn't. Sometimes it matters about, well, maybe you might have to change certain things and pivot. Maybe you're not expressing what you're trying to do very well so that people don't understand it. So, it really is mental. And do you have the mental fortitude to do this work? And if not, making sure that you have the team that can help you, because it's difficult. It's not easy.
I can totally agree with you, because I went on Clubhouse at this session. We were talking about how entrepreneurship just takes that kind of mental toll, and sometimes people look at it like, oh, I'm finally escaping my 9 to 5 for this life that I think I'm gonna have, without realizing that it actually does take a lot of work to build that type of life that you think that you're gonna have. And even if you're an entrepreneur or a small business owner, because you're a small business owner and you're your own employer and employee as well, doesn't mean that you don't do work. You actually still put in work, and just balancing the mental health. And for some people, they start entrepreneurship as a way to sort of like an outlet for what they're doing on a regular basis, and it helps them balance the other side of their paid employment, if you will. Now, before I forget to ask you, what days or times does your peer support group happen? And how far in advance do you release the schedule for, what the support class is going to be for each week?
Yeah, so Peer Support by Peer Spark happens every Wednesday night. We've been doing it since April from 7 to 8 o'clock Eastern Standard Time. And normally we release what we're talking about, the topic, every Monday. So, every Monday you could go to our Instagram, our Facebook, and kind of see what the topic is going to be. And for example, past topics that we've talked about are like sleep hygiene, right? So we'll have a therapist, a licensed clinician come on and kind of talk about certain routines and things that you can do to have a better night's sleep. Because we've noticed and heard and, hear the studies about how people are struggling with sleep during the pandemic because their routines have been messed up. So kind of how we can get back into some kind of normalcy with our sleeping patterns. But things are released, topics are released every Monday, and sessions are held virtually on Zoom every Wednesday from 7 p.m. to 8 p.m. Eastern Standard Time. Okay.
And the other thing with the support group, how anonymous is it? And is there are there standards to kind of keep HIPAA in regulation so people don't feel like, hey, I'm on there, but somebody now recognizes me from California,
Yeah, no, that's actually a great point. I'm glad you brought that up. So we do use Zoom, but we use Zoom webinar. So when we hold sessions, it will look something kind of similar like this, where you will just see me and the presenter speaking. And anyone who's a guest and an attendee, their names, however they want to display them, is up to them. It will show up in the chat as we're having conversations, and that's intentional. We don't want people's faces to be on this. We don't record it. We don't share it out. It's a private support group, not to be confused with group therapy or therapy, but really it's all about us sharing information that might be able to help people. And then also too, one of the things that I always stress is that people themselves have information. So the people who attend the sessions, also I encourage them to share things that have helped them as well, because what they're going through and what has helped them might be able to help someone else too. So it's a collective effort.
Now, as far as the speakers that you bring on board for the support group, how do you go about finding those speakers? Is it something that if somebody from the audience has like a really good topic that they feel can help with mental health, is it something they can present on the session, on the support group? Is that something they can reach out to you? Like, what's the process for your presenters?
Absolutely. They can reach out to me at info at yourpurespark.com, and let us know, what they're interested in talking about. But most of the people that we bring on are people that are in my circle and people that I know. And actually, it's funny, someone made a comment about like, wow, you bring a lot of your family on. And I'm like, yeah, because a lot of my family actually do this type of wellness work, which is kind of interesting. So yeah, it's people that I know that exist in my network, people that I might have been introduced to from other people. And, normally what happens is we'll have a conversation for 30 minutes about, who they are, what they do, and then talk about something that might be prevalent to a discussion or whatever, and then bring them on. And, normally what ends up happening is that if it's something that really touches someone, and they felt compelled or whatever, they will reach out to them. They will reach out to them and ask them, hey, do you have any sessions available? So we've seen a lot of success in that aspect. And that's why we decided to create this directory to make it real time and easy for these connections to be made. Okay.
And again, your directory is just still Massachusetts-based, correct? For now, and then hopes of scaling it up throughout the country.
Okay. Yes, correct. For probably the next year or so, we'll just be focused on Massachusetts. and see how things go. But we are open to having people outside of Massachusetts both join us on PeerSpark as attendees and even join us as a specialist to come on and talk about some of the work that they're doing.
Okay. Well, thank you so much, Nieisha, for being with us today. And before I let you go, any last words you have for the audience, be it from an entrepreneurship aspect or from a mental health advocate standpoint, or even mental health wellness?
Yeah, so I guess as it relates to entrepreneurship, one of the things that I would say is tough about being an entrepreneur is that in the beginning, you are everybody. You are the CEO, you are the salesperson, you are the marketing person, you are the accountant, you are the, you know what I mean? And I think that's where people start to look at all the work and think, oh my goodness, I did not sign up to do all of this. I just signed up to do this one thing that I wanted to do. But in order to do it well, you kind of essentially signed up to do all of these other things. So I would stress, if you're an entrepreneur who is first, just getting started, if you can find yourself an accelerator program, find yourself some interns, find yourself some support, maybe find yourself a therapist, but try not to give up. Try not to give up on your dreams. It's definitely mental when it comes to entrepreneurship. And just in general, I hope that everyone can prioritize their mental health, especially in these times. If you're tired, if you're exhausted, if you need time off, make sure you're advocating for yourself and make sure that you're prioritizing your mental health because that's your responsibility. Make sure that you're voicing it and advocating for yourself.
Thank you again, Ms. Nieisha. And if people want to reach you, they can certainly send an email or message to you at the info address that you gave, correct?
Yes, correct. It's info@yourpurespark.com, or you can find me on social media. I'm on all social media platforms. I am on Facebook. I am on Twitter. I am on Instagram. I'm also on LinkedIn. So feel free to find me and reach out to me on any one of those platforms.
All right. Thanks again, Nieisha. All right.
Bye. Thank you.
All right. All right, so that concludes day 2 of our summit. Thank you all for tuning in. I hope you had a great time listening to them. I certainly learned a lot from all our speakers that I interviewed, and hopefully someone out there has gained some ideas or is inspired to do more with the information they're learning from this summit, be it in venturing out and doing more with health coaching or educating yourself a little bit more. I did, one of the main reasons why I interviewed Ashleigh, Fabian, and Nieisha did was because they were resourceful. And I feel like going through this journey or getting started as a health coach, or when you actually do start working with your clients, it's good to have a lot of information in your toolbox. So at least now you have references and resources as to how to help people with nutrition tips or even mental health. And so again, well, thanks for tuning in. Tomorrow will be the last day of the summit. For those who want to claim the CE credits for the summit, make sure you do it by visiting the registration page. We'll have the different information on how to go about doing that. Tomorrow we have a few more speakers scheduled. I promise you, you do not want to miss them. They are great, they are fun, they have a lot of information, and I hope you will join us again for tomorrow. Have a good night and bye for now.